All right, we have some breaking news here. The CDC Advisory Committee has voted and in a 13-to-1 vote has agreed that medical workers and long-term care centers should be first in line for COVID-19 vaccines. This is their recommendation. They cite the high risk for infection within these two groups and the positive effects on hospital care. So once again, CDC's Advisory Committee recommends that medical workers and long-term care centers get priority for the COVID-19 vaccine shots.
So what has been your biggest takeaway so far from today's advisory meeting?
Thanks, Renita. Like you mentioned, we did expect a vote by 5 p.m. today, but the panel is running about an hour behind. And the reason behind that is there are a lot of questions here, right? There's a lot to go over about who is going to get this vaccine first. But there seems to be a broad consensus among the doctors on this panel that healthcare professionals will absolutely be getting the #1 priority spot in the line to get this vaccine as it's doled out. But the question that I'm hearing from a lot of the doctors in this panel that they're concerned about is how and when to involve long-term healthcare facilities in the vaccine distribution process. We're hearing from a lot of the doctors on this call today that, of course, healthcare professionals should be getting the vaccine first, but there are some concerns about how the vaccine could impact these older, more at-risk populations. So some of the doctors are just seeking a bit more data before they officially vote for that group to get the #1 priority spot in terms of the vaccine line that we are going to be talking about and reporting on for the months to come. And this comes as today we heard Dr. Fauci say that he thinks we're going to reach herd immunity by summer as we get these vaccines doled out. And the doctors on this call really recognize that we are at a peak point in this virus. One doctor talked about how the meeting was 3 hours, and given the numbers that we've seen so far, that means that about 180 people will have died of COVID by the end of today's meeting. So the doctors on the call really just talked about how this meeting couldn't have come at a more pivotal moment in terms of the country's handling of coronavirus.
Maddie, it's definitely more questions than answers with this, but I wonder, as each priority group gets fully vaccinated, how will states move forward to the next vaccine group and the next, and what will that distribution process look like?
Right, on the call today, we heard that the vaccine is going to come out in anywhere between 5 and 10 million doses per week. So even if I get this vote information in the next 30 minutes or so, there are still a lot of questions, right? If we know that the vaccine is going to go to healthcare professionals first, who are the first 5 million to get it? And that question is really going to come down to state and local officials to decide. Once the CDC panel makes this vote today, that's a recommendation that then states will have to kind of uphold and create a wider distribution plan around. So we're going to have to continue to monitor that and see how states move forward with their decisions on distribution.
Now, we've heard a lot about Pfizer and Moderna. What's happening with competing vaccine developers like AstraZeneca or Johnson & Johnson?
Right, so AstraZeneca and Johnson & Johnson's vaccines are really important when we're looking at this distribution cycle because they don't have to be kept cold, right? We're hearing that a lot of states are already sort of dress rehearsing the COVID vaccine distribution process because it's made much more complicated by the Pfizer vaccine, which needs to be kept at this extremely low temperature to keep its efficacy. So all eyes are still on the Moderna, the AstraZeneca and the Johnson & Johnson vaccines as those trials continue. We don't have a lot of information from the British government about their handling of the AstraZeneca trials. They have kept things a little bit more close to the chest than we have here in the U.S. because in the States, we're really focused on building sort of this public trust in the vaccine, and that's not as big of a problem in places like the UK. But we are hearing reports that the vaccine there from AstraZeneca could be doled out as early as this week. So there's a chance that the British government could beat us in the vaccine race.
Now, we'll keep certainly monitoring these vaccine developments, and we'll also monitor the surge that's currently happening right now. Madison, thanks so much for that.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.